And the key COVID-19 meeting that I was talking about, the Prime Minister is chairing a very important meeting pertaining to COVID-19, the preparedness. It has begun, and this is to assess how crucial steps need to be taken when it comes to COVID-19. God forbid if the cases were to rise, looking at the situation in China. A lot of mandates, including the mask mandate, compulsory mask mandate, has been done away with. So what is it? What kind of guidelines can be issued? And what is the need in terms of ramping up of the medical infrastructure that needs to be done? Now, my colleague Sharon is tracking all the details as far as that meeting is concerned. Sharon, tell us what's on the agenda. What can we expect after the meeting?
Well, first and foremost, the Prime Minister will be apprised of the situation on ground, because at the moment, while we speak, there are 4 cases of BF7. Now, this is a sub-variant of Omicron, and this is in fact the same variant which is creating havoc in China, and that is why this is a concerning situation for India as well, because there are already 4 cases. Yesterday, in fact, a case from Gujarat has come of a 61-year-old NRI woman, and now accordingly, there needs to be precaution that needs to be taken on ground. There are not going to be measures that are going to be taken on ground. So the Prime Minister will of course be apprised of what are the measures that will be taken, because there are a number of surveillance, contact tracing from district to state level. All this will be told to the Prime Minister, and accordingly if there is a need for a guideline, a fresh guideline, because yesterday after the meeting, the VK Paul, who was present in the meeting, he came out and gave a statement saying that the existing guidelines will be something that will be followed. Apart from that, 2% of random sampling tests will be done at all international airports. Now, these were, of course, till yesterday, these were the guidelines that were in fact stated by the Health Ministry. But today, considering the situation that we have 4 cases, and now the Prime Minister is being apprised of the situation, whether there is going to be a fresh guideline, because we are seeing that it is in fact a festival season. There is Christmas, then there is New Year, there is going to be crowd gathering. So whether there will be a fresh guideline will in fact be the very crucial point here, and whether that will be discussed in the meeting, and by the evening whether India will get a fresh guideline is something that we have to wait and watch for. But as of now, what all is happening, what is the situation on ground, because the Health Ministry is also in touch with all the state governments as well. They have also been told that positive samples need to be sent for genome sequencing. That is the only way to know if there is in fact a new variant, or if it's in the case of BF7, how many cases are present in India. Now, when we talk about BF7, the cases are in fact from October and September. Have in fact recovered fast. That is because the people in India at the moment have in fact hybrid immunity, have natural immunity, and the vaccination coverage has been good. But precautionary dose coverage is something that is of a concern. So there is going to be new programs that will be initiated by the Health Ministry to ensure more and more people come and get themselves inoculated with the precautionary dose, because as of now it is up to 27 to 28% of the Indian population that has in fact been inoculated with precautionary dose. More people need to come.
There's one more important point I want you to address and perhaps tell us more as you speak to the bureaucrats and the mantris who are in that very important meeting. The Union Home Ministry, after the expiry of the existing order on the 31st of March, had said that there was no need to invoke the Disaster Management Act once again for COVID-19 containment measures, and whatever measures need to be taken, that can be taken at the state level. Is there a thinking within the government to invoke the Disaster Management Act yet again? Do we know anything about that?
Such decisions, when it comes to the DDMA Act, it actually comes when depending on the positivity rate. Now, remember when this act was in fact initiated first, at that moment India had a positivity rate of and 12%. That was a very critical and worse situation that was being faced in India at that moment. After that, the positivity rate dropped to 10%, then to 5%, and now while we speak, the positivity rate is in fact 0.1%, which is very minimal. So it is very uncertain whether there is a need to in fact invoke a DDMA Act at this point. But like you pointed out, yes, the states have in fact always been told that in case they know the situation better on ground, if they think that there is going to to be some measures that they need to take, they can go ahead. If they want, for example, if they want to make masks mandatory, compulsory, that all depends on the state government. But a basic guideline that is in fact released by the MHA or by the Health Ministry is of course need to be followed by everyone.
Sharon,
But,
who
irrespective
all
of
are
that,
present
there
in
are-
that
there are-
meeting right now? Could you tell us about that? Other than the Prime Minister, who are the key dignitaries or key ministers or bureaucrats who are present in that meeting?
Well, of course, the health minister, the MOS health minister are present in this meeting. Apart from that, the senior health officials that include the ICMR officials, that include the DBT, which is the Department of Biotechnology, and the NCDC, which research on the communicable diseases. These officials will be present in the meeting. It is a virtual meeting, so the Prime Minister will be apprised of the situation on ground, and he will be told what are the measures need to be taken. And all eyes are, of course, on whether there is going to be a fresh guideline that will be issued after this meeting or not.
All right, the fresh guideline, what can be issued right now? The positivity rate, fortunately, is very, very low in this country.